Hello, I just wanted to do a quick vlog post on tips for nursing or breastfeeding. I'm currently nursing my son. He's now 7 weeks. This is my second child, and I nursed my first daughter, Jasmine, for a year. It's something as a registered dietitian I'm very passionate about. It's the best for baby. Nutritionally, you just can't beat it. And formula makers have never managed to make formula exactly the same as breast milk. Also, you're providing immunity to the baby through your immunoglobulins, and it's very convenient. But it's not easy, and a lot of people fail and give up after a few weeks. And I completely respect and understand that. I also want to say right at the beginning of this post, there's no right or wrong when it comes to feeding your child. If you choose to use formula, I completely honour and respect it. There's no judgment at all from my side. However, I just want to help the people who choose to breastfeed and the people who start off really wanting to do it and then struggle. I want to kind of just give some tips which helped me in my first week to keep you going and give you some encouragement. So when I had my daughter, it was really hard. She didn't latch on. It took 2 weeks for her to latch, and I had to use a pump and express and then feed her that from a bottle. It's really stressful, and I can understand why. I could have just kept on pumping, but what I used to do is I used to let her try and latch, and then if she didn't, I would give her a bottle. So I know she was getting the milk, but I was still trying, and eventually she got it, and it was fantastic. She thrived on it. Now my son, no problems at all. He's latched perfectly. He latched really good very quickly. But what happens is when you're in the hospital or wherever you give birth, you have colostrum at the beginning. The first few days, first maybe 1 or 2 days, you really don't produce a lot of milk. It's colostrum, high fat, full of immunoglobulins, very important for the child. And then you'll have a sensation of milk coming in, which tends to occur after a couple of days. And you can run the risk at that time, which most women encounter, called engorgement, where your breasts are so full of milk and the little baby is not maybe drinking enough of that to get it out, and it can be very painful. Now, I had this with him, and that's also your nipples become very sore because they have to kind of toughen up because babies suck really hard, but it gets better. You can get some good lanolin cream, which is actually, just in case you're interested, it's the grease from the sheep's fur. It's a natural thing. It's very safe for the baby if he or she swallows it. That's a good way to soothe the nipples. When you're engorged, showers are good. Taking a hot shower, you can actually manage to express some of the milk off in the shower. And sometimes I've found personally that changes in temperature kind of help to get rid of some excess milk. So going from a hot shower to a cold shower room, that kind of helps. Another trick is you could use a pump to take some of that excess milk off, especially if the baby's struggling to latch because the breast is too full of milk. However, you want to be easy on this initially because you don't want to overstimulate those first week. And you want really your body is so clever, and it's supply and demand. If you just stick with it, your body will adjust to produce just enough milk for your baby as they need it. And it takes a few days for that to kind of sort itself out. You'll find as the baby starts to grow and get stronger, they'll start to empty your breasts and the problem resolves itself. Another thing you can do is express over a sink manually. That kind of relieves some of the pressure and takes some of the pain. Another tip is putting cabbage leaves on your breast. Actually, the paediatrician suggested it, and I think it helped a little bit. I only kept it on for 1 or 2 hours, but some people will keep it in overnight. Also, comfortable bras, nursing bras. Invest in some good quality bras which have style and you feel good about yourself, because you still want to feel like a woman and feel good in the underwear that you're wearing, but it needs to be accessible. Also, plan your clothing around accessibility and be confident. Do it in public or find a quiet place on a park bench. Take a scarf, a very long shawl, or buy one of those special feeding shawls in your diaper bag so you can always be discreet and feel comfortable that you're fully covered. Or you might have to nip to the car and do it, so I don't have to worry about people seeing me. It's nice and relaxed and quiet. It's convenient, it's right there, it's the temperature. I really feel that if you consult your lactation consultants in the hospital, make use of them, maybe consider following up with them when you go home. Speak to family members who've been successful with it to give you tips and support, and you can do it. Even if you just do it for a few months, you're doing the best for you and the baby, and it's also a nice quiet bonding time between you and your baby. It's funny actually, today I was in my doctor's office and they were giving out formula after 6-week follow-up, even the breastfeeding mums, and I said, no, that's not right, because they could be struggling with feeding and just take that formula and not tell that they're struggling and then maybe quit. So I told my OB doctor, and actually he listened and he changed his policy. So he's only going to give it to the ones who are already bottle feeding and not the ones breastfeeding. So I wasn't going to do this post. I don't even know if many of you will be interested or listen to it. But I really want to just reach out a hand. If you want to do it and you're struggling, email me, tweet me, Facebook me. I'm here to help. I really want you to succeed because I feel it's a wonderful thing you can do. Just my personal, Rebecca's opinion, but hey, don't worry if you can't do it and you give up. No judgment. But if you do want to do it and you want help, I'm here to help.